With WebLeC, you get direct access to top experts in equine medicine and surgery.
This presentation, myself and we have a special guest star tonight from Margo from the University of Florida. We're going to talk about postpartum problems in mares with specific emphasis on retained membranes and placental evaluation. The topics I'd like to discuss are really the clinical signs, treatment, extraction techniques and prognosis of retained membranes in mares. And if we get time, we're also going to talk about the cord and norm of the chorioallantois. We may also have no visible signs of retention at all. Now, this may be the whole of the placenta or a portion of the placenta, but I've dealt with many cases in various breeds, a series of uterine lavages, some systemic antibiotics and anti-inflammatories, and is recovering very well. She's absolutely fine. But I think it's crucial to perform a follow-up examination after any retained membranes, or even after any membrane that is particularly long, with a long allantoic portion. These figures are from a survey of thoroughbred mares. We also look at the degree of twisting and
comments on the rest of James's presentation.
I think that the point about it's not a recipe-driven situation is a really good one, because each mare responds differently. We have tried all kinds of things. I like the IM or IV approach to anastomosis first. Some will use.
I'm glad to see that James had sort of brought up the topic of manual removal. I'm a very strong proponent of manual removal of the placenta. You know, bearing in mind that it has to be done gently. You cannot be aggressive. You cannot start pulling and tugging and any of this kind of stuff. But I do, if the placenta is not intact,